Someone you love has started showing subtle but concerning changes over the past year. Many people assume that death in old age happens suddenly, but the truth is that the body often sends quiet signals months, and sometimes even a year, before reaching its final stage. The problem is that most people don't notice these signs because at first they seem minor. Only later, looking back, do families realize that the clues were there all along. But by then, it's too late to prepare, too late to create meaningful memories. In this video, we'll discuss 5 important signs that often appear about a year before an elderly person passes away. Some of these may be things you've already noticed, but dismissed as normal aging. Others may seem like small changes, but actually indicate a gradual decline in the body. Recognizing these signs early allows you to provide better care, cherish meaningful moments, and, most importantly, ensure that the final phase of your loved one's life is filled with comfort, dignity, and peace. Stay with us until the end, because these 5 signs can help you prepare emotionally and practically for what's to come. When you understand what's happening, you won't be caught off guard. You'll be able to make the most of the time left with those you love. Now let's begin. 1. Significant weight loss. One of the first and most noticeable signs that someone may be entering their final year of life is unintentional weight loss. At first, it might be subtle: a belt that suddenly needs tightening, clothes that fit more loosely, or a decreased appetite. Families often dismiss this as a natural part of aging, but the truth is that losing weight without trying is rarely a good sign. It usually indicates that the body is no longer absorbing nutrients efficiently, muscle mass is decreasing, and essential systems are slowing down. Aging naturally causes some loss of muscle mass, but when it happens too quickly, it's a sign that something deeper is going on. The body may be struggling to digest food properly, or the person may no longer be able to process proteins effectively, leading to muscle loss. This loss of strength not only makes movement more difficult, but also increases the risk of falls, weakens the immune system, and leaves the person more vulnerable to infections. Another common reason for weight loss in the final year of life is changes in appetite. Many elderly people simply stop feeling hungry as they once did. Their sense of taste begins to fade, food no longer seems as flavorful, and they may start skipping meals or eating much smaller portions. This isn't just a matter of preference, it's a physiological change. The body begins to sense that it's entering a shutdown process and no longer sends signals to the brain to seek food as frequently. Less energy, less strength, and a gradual decline in overall health follow. Additionally, underlying medical conditions play a role. Weight loss is a common symptom of chronic illnesses like cancer, heart failure, or kidney disease, all of which can progress long before more obvious symptoms appear. Even conditions like depression or cognitive decline can lead to reduced eating, creating a cycle where the body doesn't get enough fuel to sustain itself. Many families try to address this by encouraging their loved ones to eat more, offering favorite foods, or supplementing meals with protein shakes. However, if weight continues to drop despite these efforts, it's important to recognize that the issue isn't just about diet, it's the body preparing for a deeper transition. At this stage, forcing large meals may not be helpful. Instead, focusing on comfort, easy-to-eat foods, and hydration can make a big difference in maintaining quality of life. If you notice significant weight loss in an elderly loved one, especially if they're eating less, feeling weaker, or struggling to stay active, it's time to pay attention. This isn't just about physical appearance, it's the body sending a message. Understanding that message now can help you prepare for what's to come with clarity, compassion, and the opportunity to make every remaining moment meaningful. 2. Extreme fatigue and weakness. One of the most noticeable changes in the year leading up to the end of life is a deep, persistent fatigue that doesn't go away with rest. This isn't just the tiredness you feel after a long day. It's an intense exhaustion that makes even the simplest tasks feel like a huge effort. Getting out of bed becomes a challenge. Walking from one room to another requires energy, and activities that once seemed routine like cooking, dressing, or even holding a conversation, start to feel exhausting. This isn't just a normal part of aging. It's a sign that the body is conserving its remaining energy as organ function begins to slow down. The heart no longer pumps blood as efficiently, circulation weakens, and muscles don't receive the same amount of oxygen as before. As a result, many elderly people in their final months feel weak, unsteady, and unable to maintain the same level of activity they once had. Another important factor is the slowing of metabolism. The body is naturally designed to produce and use energy, but as it prepares for its final phase, that energy is redirected. Instead of being used for movement, the body focuses on preservation. This is why someone in decline may start sleeping more, needing longer naps during the day, or finding it difficult to stay awake for long periods. Some may even experience sudden drops in energy, seeming fine one moment and completely exhausted the next. Perhaps the hardest part of this process is the emotional impact of fatigue. Many elderly people who once valued their independence begin to feel frustrated or even ashamed that they can no longer do what they used to. They may withdraw from conversations, avoid social interactions, or stop engaging in hobbies, not because they don't want to, but because they simply don't have the energy. This can lead to a cycle of isolation, where the person stops trying altogether, accelerating the decline even further. For families, watching a loved one go from active and engaged to exhausted and withdrawn can be painful. It's easy to assume they're just being lazy or need to push themselves harder, but the reality is that forcing them to stay active won't help. What's most important is understanding their limits, allowing them to rest when needed, and making their remaining days as comfortable as possible. If you notice that a loved one is experiencing deep, ongoing fatigue that doesn't improve with rest, take it as a sign that their body is undergoing a major transition. This is the time for meaningful conversations, creating moments of peace, and supporting them without expectations. Because in the end, what matters most isn't how much they can do. It's that they feel loved, understood, and at peace. 3. Increasing cognitive confusion or withdrawal. As a person approaches the final phase of life, one of the most striking changes can be seen in how they think, communicate, and interact with others. You may notice that someone who was once attentive and engaged begins to forget things more often, struggle to follow conversations, or seem disoriented in familiar places. They may repeat information, forget names, or lose track of time, even if they've never had memory problems before. These subtle changes can start months or even a full year before passing. This isn't just ordinary forgetfulness. The brain, like any other organ, needs a constant flow of oxygen and nutrients to function properly. But as circulation weakens and the supply of oxygen to the brain decreases, cognitive function begins to deteriorate. The person may become easily confused, have trouble making decisions, or even struggle to recognize people and places they've known for years. In some cases, there may be brief moments of clarity followed by sudden episodes of confusion, as if the mind is oscillating between awareness and forgetfulness. Another common sign is emotional withdrawal. Those nearing the end of life often lose interest in social interactions. You may notice that they speak less, engage less, or spend long periods sitting in silence. It's not that they no longer care about their loved ones. It's that their brain no longer processes emotions and interactions the same way. Conversations become tiring, noisy environments become overwhelming, and over time, many elderly people retreat into their own inner world. You may also notice changes in mood and behavior. Some people become more irritable, anxious, or easily frustrated, while others seem unusually calm, distant, or indifferent to things that once mattered to them. This isn't just a change in personality, it's often the brain adjusting to the body's decline. As cognitive function slows, emotions become harder to express, and the person may stop reacting to situations the way they once did. For families, this phase can be especially difficult. Watching a loved one lose touch with reality or withdraw emotionally can feel like a goodbye before the end. But it's important to remember that this isn't something they can control. Instead of trying to bring them back into conversations, The best thing you can do is meet them where they are. Speak gently, offer comfort, and understand that even if they don't always respond, they can still feel your presence. If a loved one is becoming more forgetful, confused, or withdrawn, don't ignore it. Often, these are signs that the body and mind are preparing for the final transition. This is a time to be patient, value moments of silence, and create an environment that feels safe, familiar, and peaceful. Because even when words fade, love and care can still be felt. Fifth, frequent infections and slow healing. As the body begins to slow down, one of the clearest physical signs is a weakened immune system. You may notice that someone who rarely got sick now seems to catch every cold, flu, or infection that comes along. Illnesses that were once minor now take much longer to heal, and even simple injuries like cuts or bruises take longer to recover. These changes don't happen by chance. They're signs that the body can no longer defend or heal itself as it once did. One of the biggest issues is recurrent infections. Pneumonia, urinary tract infections, skin infections, and even mouth infections become more common as the immune system weakens. Many families assume these are just isolated illnesses, but when they start happening frequently or take a long time to heal, it can be a sign that the body is losing its ability to fight infections. Even antibiotics that once worked quickly may seem less effective. The person may need stronger medications, longer recovery periods, or multiple rounds of treatment for infections that would have been easily resolved before. This happens because, with slower circulation and declining organ function, the body simply doesn't respond to treatments as well as it once did. Another often overlooked problem is chronic wounds. If you notice that small cuts, sores, or bruises aren't healing properly or keep reopening, it could mean that circulation is compromised. Reduced blood flow prevents oxygen and nutrients from reaching the skin and tissues efficiently, making healing much slower than normal. Pressure sores, bed sores, especially in people with limited mobility, become a serious risk and can lead to severe infections if not properly cared for. What's most concerning is that, in the final year of life, infections often don't show the classic signs we expect. Instead of a high fever, an elderly person may simply seem more tired than usual, more confused, or less interested in eating. In fact, in many cases, a sudden decline in mental clarity is the first sign of an infection before other symptoms even appear. For families, watching a loved one go through frequent infections can be frustrating and worrying. It can be tempting to insist on aggressive treatments, hoping that another round of antibiotics or another hospital stay will solve the problem. But at a certain point, the focus often shifts from cure to comfort. Ensuring the person stays hydrated, keeping their skin clean and moisturized, and minimizing stress on the body can do more for their well-being than another medication that only prolongs suffering. 5. Significant changes in breathing or circulation. One of the most evident signs that the body is preparing for its final phase is a noticeable change in breathing patterns and circulation. You may notice that your loved one begins to breathe more slowly or shallowly than before. At times, there may be pauses between breaths, or breathing may become irregular, speeding up and then slowing down unexpectedly. Some people develop a breathing pattern called Cheney-Stokes respiration, where breathing alternates between deep, rapid breaths and long pauses. These changes may start subtly, but become more pronounced and frequent over time. Another common sign is weakened circulation. You may notice that the person's hands, feet, nose, or ears start to feel cold to the touch. Their skin may appear pale, bluish, or mottled, especially in the fingers and toes. This happens because the body is prioritizing blood flow to vital organs, reducing circulation to the extremities. It's a clear sign that the heart is no longer pumping blood as strongly as before. Some people also begin to experience more shortness of breath, even with minimal movement. Simply sitting, talking, or changing positions can leave them winded. You may notice they start breathing more through their mouth or need to stop suddenly to catch their breath while speaking. If they used to walk across a room with ease but now struggle, it could indicate a decline in lung function. In some cases, fluid buildup in the lungs can make breathing difficult, causing a persistent cough, gurgling sounds when breathing, or even a feeling of tightness in the chest. Many people assume this is just a cold or common congestion, but in elderly individuals nearing the end of life, it's often a sign that the lungs are weakening. This can make lying flat uncomfortable, and the person may prefer sleeping with their head elevated on pillows or even in a recliner to make breathing easier. For families, seeing these changes can be frightening. It's natural to want to help, encouraging the person to take deeper breaths or worrying that something serious is happening. But in many cases, this is simply the body's natural process of slowing down. There may be no way to reverse these changes, but there are ways to make this time more comfortable. Keeping the room cool, using a humidifier, or offering small sips of water can help ease discomfort. In some cases, medications or oxygen therapy may provide relief, but the focus shifts to comfort rather than trying to fix the problem. If you notice these signs, changes in breathing, cold hands and feet, or a bluish tint to the skin, pay attention. These are often signs that the body is conserving energy and that circulation is slowing. This is a time to be present, offer reassurance, and create a peaceful environment where the person feels safe and comfortable. In the final months or weeks, the most important thing you can offer isn't medical intervention. It's comfort, dignity, and the assurance that they're not alone. As we come to the end of this video, take a moment to reflect on what we've discussed. Significant weight loss, extreme fatigue, cognitive decline, frequent infections, and major changes in breathing and circulation. These 5 signs often appear in the final year of an elderly person's life. They may not all happen at once, and at first, they may be subtle. But when you start noticing them, it's an indication that the body is preparing for its final transition. For many families, these changes are hard to accept. It's natural to want to fight them, to encourage a loved one to eat more, move more, or push through the fatigue. But sometimes, the best thing we can do is listen to what the body is telling us. Instead of focusing on trying to reverse the inevitable, we can focus on making this time as peaceful, comfortable, and meaningful as possible. Understanding these signs doesn't mean fearing death. It means being prepared for it. When you recognize these changes early, you can provide better care, make important decisions ahead of time, and ensure that your loved one's final months are filled with love and dignity. This is the time to cherish every moment, share stories, and show that this person matters and will never be alone. If you're noticing these signs in someone close to you, take a deep breath and remember, you're not alone on this journey. Many families have been through this, and while it's never easy, knowing what to expect can help you find strength, patience, and peace. Thank you for joining us today. We'd love to hear your thoughts. Leave a comment below and share something you learned today and how you plan to apply it in your life. Your feedback is very important to us, so don't hesitate to share. Reading your comments motivates and encourages us to keep going. If you enjoyed this video and found the information helpful, please like, subscribe, and share. Thank you for watching, and see you soon.